We hope you enjoyed the Laser Light Show depicting Griffin's 110-year commitment to caring for its community. We now invite you to envision a future in which chronic disease is prevented before it has a chance to take hold. And when it does exist, it's managed more effectively to avoid acute illness that causes disability and requires frequent emergency care and hospitalization. And when hospitalization is unavoidable, inpatient care is safe, effective, person-centered, and lower cost. That future is not an unattainable aspiration. It's a reality that is taking shape on the very ground where we celebrate tonight. There is a growing recognition that the fee-for-service payment method that fuels the U.S. healthcare delivery system is driving a level of healthcare spending that is simply unsustainable. In addition to excessive cost, fee-for-service incentives have resulted in hospitals being inwardly focused, reactive, and organized almost exclusively to deliver acute care. New value-based payment incentives are motivating hospitals to shift their focus, build new capabilities, and form relationships with other organizations and providers to improve the health and well-being of entire populations, reducing the need for sick care and driving down healthcare costs. Griffin Health is working to build a community where healthcare partners collaborate to provide effective, coordinated, high-value care. Instead of reacting to illness, we believe that it is both our mission and our responsibility to inform and empower individuals to make choices that lead to a healthier lifestyle and improved quality of life. This perspective is shared across the Griffin organization, including by Griffin faculty physicians, our multi-specialty group practice that is committed to building a meaningful relationship with its patients and to guiding and coaching them to enhance their well-being. By embracing this change and choosing to lead the shift from volume-based to value-based healthcare delivery, Griffin Health is helping to transform the Connecticut healthcare landscape and defining the high-performing health system of the future. Our population health management approach extends into the community through preventative health care and disease management programs, partnerships with local organizations, and agencies to offer education and services that improve care coordination and the effectiveness of care, and address the underlying social determinants of health. Griffin Health is not only talking about transformational change, we are committed to it. We have invested in it, and we are taking the lead. This year, Griffin Health will open 2 new ambulatory care centers, one at the corner of Commerce Drive and Bridgeport Avenue in Shelton, and the other here at Quarry Walk. The centers and the programs and services they will offer are designed to serve as the hub of our population health management activity and position Griffin for success in the emerging value-based healthcare environment. The new Shelton Family Healthcare Center at 110 Commerce Drive in Shelton consolidates several Griffin faculty physicians' primary care and specialist offices, as well as a number of hospital outpatient services under one roof to facilitate accessible, comprehensive, and coordinated care. An expansive and thoughtfully designed next-generation primary care office will anchor the center, offering 25 exam rooms with integrated consultant space for 8 primary care providers, visiting specialists, and co-located behavioral health care providers. The center will also include a procedure suite, diagnostic X-ray and lab services, and a health resource area. In addition, the facility will be home to an independent dental practice that will team with Griffin's providers to expand care options and improve care coordination. Our second center here at Quarry Walk personifies Griffin Health's vision for the future of healthcare delivery and population health management. Here again, Griffin faculty physicians' offices will serve as the foundation of an advanced healthcare complex. Griffin faculty physicians will be joined by Valley orthopedic specialists and caregivers from Griffin Hospital to offer comprehensive primary and specialty medical care, highly advanced diagnostic and rehabilitative services, health promotion, lifestyle changes, and chronic disease management programs to meet the needs of a growing Oxford community. The Griffin Health facility and all that it offers supports Quarry Walk's innovative, wise and well design that blends residential, recreational, and retail components with numerous amenities, such as a walking trail, a community green, and an amphitheater for live performances to offer residents and patrons an improved experience and better quality of life. Griffin will enhance Quarry Walk by providing a spacious conference facility that includes a state-of-the-art teaching kitchen to support interactive nutritional education and healthy cooking demonstrations. Griffin Health is also responding to the need for imaging services in the northern Naugatuck Valley with a proposed new 64-slice CT scanner and an advanced 3 Tesla MRI unit, which will bring new diagnostic capabilities to the region. Our Imaging and Diagnostic Services Center will provide one-stop shopping, offering the patients of our Quarry Walk healthcare providers convenience and the peace of mind that comes with expedited testing. Griffin's innovative new facilities are more than just bricks and mortar. These new healthcare homes will feature unique person-centered services that elevate the relationship between patient and provider to promote wellness within and beyond their walls.
Our new healthcare facilities in Shelton and in Oxford at Quarry Walk will not only be a healing environment consistent with the design principles of Plaintree, which you can see at Griffin Hospital, but will also be incorporating a new next-generation physician office design. Exam rooms in those new facilities will encourage interaction between the patient and the physician. We'll be de-emphasizing the actual exam and promoting interaction by building in consultation space in the exam room. There'll be a place for a physician to sit down with a patient, to talk about their illness, to talk about choices that the patient has, and to develop the best plan of care for that individual.
Given that we believe that population health improvement efforts should concentrate on the complete well-being of individuals, both the Quarry Walk facility and the Family Health Center in Shelton will have a licensed clinical social worker on site to meet with patients and discuss their emotional needs and provide assistance to overcome any social obstacles to care compliance and healthy behaviors.
If we're talking about building positive working relationships between the patient and their provider, a true partnership that focuses on well-being and disease prevention and developing a comprehensive plan for keeping people healthy, we don't want the whole focus just to be on the sick care interaction. We really want to make sure that we have a rapport built between our providers and the patient. The design will help facilitate that.
In addition to the wellness programs that will be held at the Quarry Walk Community Conference Facility, the primary care offices located there will be a place for patients to receive one-on-one coaching on important lifestyle changes that can help prevent chronic disease, and where those with chronic illness will partner with their healthcare providers to develop individualized plans to help them manage their condition more effectively.
Griffin is really looking to improve the patient experience while improving our ability to take care of patients. And one way to do this is by kind of reinventing the primary care office. It focuses more on teaching, education, talking with families, talking with patients. It also allows us to have space to bring in family members and have family members involved if the patient wants. All of these things together allow us to improve both the experience and the ability to care for people.
Griffin's advanced patient care approach also goes beyond the walls of the physician's office. Griffin Faculty Practice will offer patients ingenious home monitoring devices that allow clinicians to remotely assess important health metrics like weight, blood pressure, heart rate, and oxygen level. Instead of trying to connect with patients over the phone and asking them to manually measure and report biometric indicators, the remote monitoring device sends information directly to the patient's care team of nurses, physicians, and care coordinators, so they can watch for changes and immediately intervene if a reading sends up a red flag.
So if an alert would come in on a patient, it would go to the care coordinator immediately. She would get either a ping or a text onto her email, phone, and she would immediately reach out, depending upon what the criteria of that data being reported was. She would then immediately reach out to whether it would be the PCP or to the cardiologist, whatever specialty would need to be notified to make an impact for that patient for improvement.
Research has shown that a person's genetic makeup can put them at increased risk for a number of diseases. Therefore, Griffin Health is embracing new advancements that enable genetic testing in the primary care setting to improve the effectiveness of its effort to help individuals maintain their health and well-being. Griffin will soon offer comprehensive primary and preventative care genetic testing and expert consultation, starting at Quarry Walk and the new Family Healthcare Center in Shelton.
Genetic testing uses your own DNA to evaluate whether you may carry certain markers or genes for a specific condition or developing a specific condition. There are a lot of things you can learn from genetic testing. Primarily, it's your risk level. So conditions from high cholesterol, ranging from that all the way to breast cancer risk. Depending on the genes, we can understand what your likelihood of developing a certain condition is.
Just as the magnificent Quarry Walk development is transforming the town of Oxford, Griffin Health is transforming healthcare and empowering our community and its residents to take control of their health and well-being and improve the quality of their life. Thank you for your support. Because of you, the better healthcare we envisioned is becoming a reality.